nice dinner, and that was fun, getting to see everybody beforehand. And Tom was there. Tom could not come today because he's with his family and watching his granddaughter today, so that'll be fun. I said she could come. She's more than welcome if she wanted to. But let me move forward and introduce Sharon Dewey. She is a licensed clinical counselor in Monroe County.
Morrow.
Morrow County.
Oh,
Yes,
my
thank you.
gosh.
Let's get that
My
right.
husband worked
Right.
there.
And clinical
In the ER.
manager with Centero. She has been in mental health field for over 25 years and served in a variety of populations. She specializes in training and extensive experience in post-trauma, severe post-trauma. So that's why she's here today to talk about that. She's currently oversees the clinical clinicians in 4 school districts in Morrow County and is overseeing an opening of an outpatient office to help meet the needs in that county as well too. We have connected with Centero. Centero is a group here around the whole entire state, would you say?
Well, primarily Franklin, Delaware, Morrow are our primary ones, but we're doing these kinds of things statewide.
Yes,
Yeah.
and what they've done is they've connected within our school districts, and so they work with our kids, they give them tools, and so then, and they're really noticing that trauma is affecting within students, but then within families, within specialties of different occupations, and so that's where physician families fit and how that role comes. We appreciate you coming so much, thank you. And we're gonna have a little video too, so then we can send that out, which I'll kind of talk a little bit about too.
What time are we aiming for?
Oh, a little, like, probably a little bit before 11,
Okay.
and then, yeah, we'll do questions between that.
Great, okay.
Thank you.
As she said, my name is Sharon Dewey. I'm not Ashley. Ashley wasn't available. She's with family today. Ashley runs our Backing Our Front Line program, which is something that was started during the pandemic to help first responders, medical personnel, teachers, all of those folks that were sort of in the middle of everything as things got even harder than they normally are. And we provide 6 to 10 sessions for folks in those positions when something is just feeling out of line, right? And so during the pandemic, those were things like, I'm just so overwhelmed by all of this stress and we keep going to work and other people don't have to, and all of those kinds of things. It's continuing for those situations where they get sent out on a call that is just beyond what they're even used to. And so to sort of help, we go in and help process those major events, but we have those ongoing things with folks available now to help with that sort of stuff. So if you ever find, and it's available to families as well. So if you ever find yourself in a situation where it just feels like the world is blowing up, certainly let us know. We can help with those kinds of things. We're just gonna talk a little bit about trauma, the signs and symptoms, how we provide support, and resources that are available. Trauma. Anybody have any ideas off the top of your head? What are the things that come to you when we talk about that?
Excuse me.
What? Teenagers. Good. Damage. Anybody else have any ideas?
Like physical and mental trauma.
Right.
An abusive incident.
Mm-hmm.
Crime.
We think about those. What?
Crime.
Yes.
Violent or non-violent.
Violent. Right. All those things that make us feel unsafe.
I think about the medical family, you may hear about someone's trauma.
Secondary.
You've never even met them, but you will feel,
Yes.
their
Yes.
empathy towards them and how
Yes.
you place them.
And we talk a lot in trauma therapy about what we call big T traumas, which are the like, somebody just stole my car at gunpoint, and those kinds of things. Or we had a fire at our house, or, in terms of like a surgeon, something not going as expected, those kinds of things. But all of us sort of experience those little T traumas where they just sort of build on each other, right? And sometimes that's that secondary piece where it isn't necessarily that one particular thing that somebody's told you, it's then compounded with all of the other things, right? And you realize all of a sudden, like, this is my life. Like that this is what I'm hearing every day about somebody went in and they had to do X, Y, and Z, and this is overpowering. And so it isn't one particular thing, it's when we stack all of those. And so that can be a traumatic response also. Trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful, or the threatening that has lasting adverse effects on the individual's functioning in physical, social, emotional, and spiritual well-being. Substance abuse, that's from the Services Administration, so that's their technical definition. Trauma has been characterized by, more broadly by others. For example, Horowitz defined it as sudden and forceful event that overwhelms a person's ability to respond to it, recognizing that a trauma need not involve actual physical harm to oneself. An event can be traumatic if it contradicts one's worldview and overpowers one's ability to cope. So what we talk about is when something happens, all of a sudden you sort of feel like, whether it's that shutdown or I need to run, and we'll talk about fight or flight in a minute, but that we've all talked about that, right? When something happens, I either need to get out of here or I'm gonna hide in this corner, right? And a lot of times you can then talk your way through that, you settle down. The ongoing trauma piece is when you feel like that's not happening, right? When you are the rest of the world is going on and you feel like you're not, right? And when we have things that happened last year at Big Walnut, we had a little boy who was hit by the float that he was riding on in the homecoming parade, right? And so unfortunately, everybody in 5th and 6th grade was there. And they were all, some of them were on the float, some of them were walking beside the float. We went into the school after that and we said to all of them, you are exactly where I think you're gonna be right now. Whatever that is, you're exactly where I would expect you to be. If in 3 weeks you're not sleeping, you have no interest in food, you don't want to do anything that you wanted to do before, you feel like you're angry with everybody all the time, those are the things we want to know, right? If you feel like the rest of the world has moved on and you're not, that's what we're concerned about. We're supposed to have a reaction when something traumatic happens, and sometimes it's just harder to deal with than we think it should be, right? So that's that ongoing piece. Types of trauma. Acute means it is right now, right? It is a single incident. I just got chased out of my house because it was on fire. I don't know what I'm gonna do now. The response is during and directly after an event. Car accidents, loss, victim of a crime. I know what's happening, right? This has happened in this moment. Chronic is a long-term response form prolonged from, I'll correct her, prolonged or repeated events, and that's that abuse piece in a lot of cases, right? We see a lot of kids where they're sort of huddled into a corner and they're not talking about anything yet. We're starting to figure out what might be going on. It doesn't mean we're right, but we're starting to figure out what might be going on. And they'll start to tell you, I always feel this way. I don't remember a time when I didn't feel this way. Complex, we see a lot of these. Multiple events that may or may not be related to one another. Those are the long-term abuse, that things sort of pile on each other. And you'll see kids come in and people come in and they'll be like, well, I was doing okay, and then my grandmother died, and then we got evicted, and then, you know, like there just becomes this list, and you're sort of like, yeah, I get it, right? That's a lot to take on. And it's not an easy solution. Like when we're looking at an acute trauma, we're dealing with that one piece. It's, I don't want to say easy, but certainly easier than picking apart the complex parts. Physician trauma. 2019, I know that feels like it was forever ago because it was pre-COVID. It's the most recent stat we have, published in the Journal of Patient Safety. More than 2/3 of providers involved in an adverse clinical event suffered from troubling memories, anxiety, anger, remorse, and distress. And I know in your homes you probably see some of that, right? And it doesn't, they may not come out and tell you that, right? I mean, it may not be an obvious, this is what happened today. We've got all those confidentiality things where you're not necessarily gonna come home and say, and then this happened, and then did you see it on the news? Yeah, that's us, you know, all of those kinds of things. But 2/3 of them have been involved in something, and whether that's that secondary trauma of somebody came in and told me this, and I don't know what to do with it. It's very rare anymore that somebody tells me something I haven't heard in some way, shape, or form before, right? But every once in a while, there's that story where you're like, oh, that was an additional piece that's hitting hard that I was not prepared for. And so you sort of carry that, and you can sort of feel it and see it. 2013, they further found that up to 43% of physicians suffer from depression, anxiety, post-traumatic stress disorder, PTSD, or even suicide in the days and weeks that follow an unexpected patient event. So that's that next level, right? We're saying that a lot of people, when something terrible happens, feel that. We sort of expect that as human beings, right? This is that next level of, not only is this happening, I can't handle it. And those are the ones we're watching for. So, fight, flight, freeze, fawn, right? And fawn might be new. When I was little, we talked about fight or flight all the time, and those were the only two choices, and you were either gonna beat them up or you were gonna run away, right? Which neither one of those choices were great for me. What?
I'm a freezer.
Yeah,
Yeah, I
right.
figured that one, I added that one.
Well, and I
Yeah,
think
it's
I
like
think we all started noticing that, like, what about those of us who don't run, right? If I'm running, you should run too, because something dangerous is occurring in the moment. But also are not, like, you might have this feeling, but I'm not gonna be a fighter, right? And sometimes you hit that point where it is just, you are frozen, right? And we'll see the look kind of change, and you're just sort of like, okay, we're gonna have to take some time and pull you out of it. And sometimes we talk about that as like a shock reaction, right? That somebody, you're sort of like, are you all right? Are you all right? And they're not really responding. And that's kind of that piece of it, that you just shut down to the point that you are done, right? Fawn is relatively new, and that's appeasing or complying with the threat to avoid the conflict, right? So whatever it is kicks in automatically, and if somebody says, you're coming with me, you're like, okay, right? And your brain is able to do that. I'm not sure that mine would. I don't know. Fortunately, I've never been in that situation, so I don't have to know. But there are things where when somebody is in sort of that shock state, you can sort of see it, and like police may show up and they'll say, we're gonna go over here, right? And that person is able to follow those directions and they're able to work with them. But it's not this extreme, but they're kind of still not making their own decisions, right? They're willing to go with you, but it's a little bit different, and I'm just gonna, and so it's just kind of a new observation that there are 4 choices. We aren't pigeonholed into that just running or fighting. The autonomic nervous system, all sorts of things that we're sort of watching for in that moment. Pupils change, muscles, those kinds of things. That's what that system is in charge of, right? And sympathetic, we see all of those. Those are those different responses on how people are going to go. And those fight or flight, some people can be in more than one category. In the moment, I think most people probably are one or the other. If you think about it, do you feel like if something were to happen, do you know what you said you already know?
Well, I freeze, but then you're training. Like if it's,
Yes, it kicks
somebody
in.
needs CPR, it's like, there's like a few seconds where, and other people are, bam, they are on it. I have 2 of those in my family, thank goodness.
Right.
They're just like there.
Yeah,
And I freeze, and then I think, okay, gotta do this.
right.
It
I know
might
what to
only be
do.
a few seconds,
Yeah.
but it
Yeah.
is a definite delay.
Yeah. And at least it's not a I'm running away.
Yeah, I usually don't do that.
Anybody else know what their automatic response is? No?
Mine would, I wouldn't say fight, but more like,
React.
I was a ER trauma nurse,
Yes.
so it's kind of in your blood to just
Yes.
address
Yeah.
problem,
Right.
get taken care of immediately,
Right.
and think about it later.
Right. And thank goodness we have those of you who do that, right?
Yes.
Because when you're in that
Yes.
moment, we need somebody who says, yep, it's time to go, right? Because I'm probably like you, Chris, and I'm sort of like, okay, I'm ready, but tell me what to do. My brain is
Yeah, you gotta
not
do
there, and
something.
it'll kick in a minute,
Yeah.
but it's gonna take me that minute, and that might be too long.
And the nurses and the doctors, those people are already on it.
Yeah,
They're
yeah.
already putting
And that's
pressure on
probably what
it.
makes my brain go, oh yeah, that's what I'm supposed to do. She knows what she's doing. I'm going with her. Okay. The impact. During times of stress, the hypothalamus, all of the brain terms, right? That connects the brain and the endocrine system signals the pituitary gland to produce a hormone, which in turn signals the adrenal glands to increase the production of cortisol. All that to say a lot to say your hormones kick in. And I think we talk a lot about hormones in teenagers, right? And how powerful they are. They really do play an incredible role in all of these things. And I think we're just getting to where we sort of understand how all of those things come into play. I actually have a clinician that works in one of our schools who her cortisol levels are sort of always in overdrive because of a past trauma. And so she'll wake up in the morning and she'll call me and she'll be like, this is going to be one of those days where I just can't settle down. And we'll talk about, you know, like, well, what can we do? We're going to go into school later than expected. We're going to give you some time. We're going to do those things. You know, and so starting to become aware to how you react to some of those things and be able to deal with that effectively sometimes helps. Cortisol increases the level of energy fuel. So that's why you feel this, right? Whether you're going to run when you feel this or you're going to fight, that's that cortisol like charging in. And by mobilizing glucose and fatty acids. So it's taking things that you've eaten, breaking it down, turning it into things that can be used in an instant. It's normally produced in varying levels throughout the day, typically increasing in concentration upon awakening and slowly declining throughout the day, providing a daily cycle of energy. So we all can sort of feel that, right? I don't know that mine's highest in the morning because I am not a morning person, right? It takes a little while for that to kick in. And then I feel pretty good through the middle of the day. 2 or 3 o'clock, I would like to take a nap. That doesn't usually allow itself, you know, those kinds of things. But you start to notice those. And some of that's cortisol, and some of that's when you eat, and some of that's how well you sleep, and all of those kinds of things. But it all comes into play. During a stressful event, an increase in cortisol can provide the energy required to deal with prolonged or extreme challenge. So we want that, right? What causes the problem is when it's there and we don't have a way to deal with that, right? Or it's a reaction to something that isn't a current threat. When we have the current threat, we want to be able to move and do all of the things that we need to do. When you have an anxiety brain, as we say, some of us are definitely prone to that, we're always ready for whatever's going to happen, right? It doesn't matter. You can, you know, somebody will say, I never thought of that. And that's a foreign concept to me because I've always thought of everything, right? If I'm walking in this room, I've thought about where the exits are. I know what the choices are, how many people are going to be in here, where you're from, what kinds of things you do. Like my brain, and it's not necessarily true, right? My brain has made up all of these options, right? So that I am prepared for any moment. Now, people who live with anxiety brains are really good in these moments. We tell our kids, they're like, I'm so anxious all the time and I don't know what to do with this. And when a crisis happens, when the fire alarm goes off, those kids know exactly what to do. They're the first in line. They're the first ones out the door. They're the first ones saying, I'm here, teacher. I know where I'm supposed to be, what I'm supposed to do. Because they've thought that through and they're prepared. What causes issues with them is when they're sitting in the classroom and they're waiting for the fire alarm to go off. Because I need to be ready when the fire alarm is going to go off, or because I need to be prepared. And then you start seeing this, and they need to move, and they get a little antsy because their brain is always ready for that moment. And we need to be ready for the moment, but we don't need to be ready for the moment, right? You know the difference between the two of those. Chronic stress can result in impaired communication. This has been linked to the future development of numerous physical and mental health conditions, including chronic fatigue, metabolic disorders, diabetes, obesity, depression, and immune disorders. And you're all medically related people. You know that we're guessing, theorizing what causes what. But we know when people are chronically stressed, we feel that, right? And it's eventually having an effect on our bodies. And so that's what we're looking at, is how do we sort of control the chronic stress so that it isn't leading to other things that are physically affecting us on a daily basis. Signs and symptoms. Physical or somatic, these are kind of like those, when we ask kids, how do you feel? These are the things we get automatically. Increased heart rate, sweating, shakiness, tingling, body tension, lethargy, heaviness, low energy, hypervigilance, digestive problems. A lot of kids will come in, a lot of people will come in saying, my stomach just is a mess all the time. It hurts, it's gross, it's, and we obviously do not want to assume that that's a mental health thing, right? There are a whole lot of things that cause your stomach to be upset, from what you just ate to what you did the day before to whether or not you slept. But if we're seeing that with some of these other things as an ongoing thing, we want to take that into account. sexual dysfunction, we don't talk about that with little people, obviously, but it does come into play with the rest of us sometimes. Emotional. People are not as good at telling us about these things, right? And they know they're there, but I think it's harder to put labels on them. Some of it, most people directly will not tell me that they feel angry all the time. They might call it irritability. Their partners or the people who live in the house with them will tell me that they're angry or irritable all the time. I think it's just hard to notice in yourself sometimes until you see it somewhere else. Mood swings, sometimes people can tell, they're pretty good about telling us that they feel depressed. They don't necessarily tell us that they sort of feel this. They don't notice that, because when I feel good, right? Sadness, difficulty maintaining attention. I think it's hard to report that sometimes. We notice that with ADHD kids as well, because you're having a hard time paying attention, right? So it's hard to notice that you're having a hard time paying attention. Terror, sometimes that's nightmares. Sometimes that's just like I walk into a room and there's sort of like this reaction. Shame, guilt, denial, anxiety, isolation from social supports, they'll sort of start to withdraw. Sleep disruptions, we hear a lot about, nightmares, flashbacks, and that's sort of like that nightmare while I'm standing here, right? All of a sudden, I am just there, and I don't necessarily know what triggered it sometimes. Sometimes I do, right? It's a smell, it's a sound. If fire folks are involved in big fires and that alarm goes off, sometimes that's a trigger, right? Panic attacks, and that's just that feeling of it has a lot of this stuff in the moment, right? And you just like, things feel out of control. And avoidance of activities or places which trigger things, right? So if I'm a hospital person and something's happened in a hospital and I don't want to go back to that hospital, that becomes very difficult. Medical, heart disease, stroke, high blood pressure, diabetes, chronic pain, headaches, weak immune system, obesity, all of the things we're all watching for in our lives all the time, right? And it's just saying that some of this stuff comes into play. Obviously, all of these things are independent and can be their own thing, but we do want to pay attention to those as well. Providing support. We're going to watch for changes. We're going to be aware, right? And as I said, sometimes you don't notice it in yourself. A lot of times people come in and they're like, I don't know what they're talking about, I'm fine. This is exactly how I've always felt. And then the person who lives with them will say, actually, a year ago, you were a totally different person. We were going out, we were having fun, we were finding things that we did. Now, like getting you out of the bed is difficult, right? Finding something you want to go do is difficult. You used to have things you were interested in. I don't see that in you. And sometimes they'll say, yeah, and sometimes they'll say like, yeah, my hobbies have just changed. Okay, but if your hobby changes, then it's that you found something else you were interested in, not typically that you now have nothing that you're interested in. So we want to watch for the changes in behavior, affect. Sometimes they go from, yeah, I'm interacting with you to everything, right? If they don't seem like they're seeing joy in any moment, we want to be concerned about that. We want to pay attention. Communication levels, we all know that there are certain people who back off. They're introverts, however we want to label that they need to gain energy from being by themselves. That's a totally different thing than this person is now not communicating with anyone. Interest in hobbies and previously enjoyed activities. And a lot of times people will just say, I don't have the energy. It's not that I don't like it, I want to do it. I just don't have the energy, right? I just can't. We're going to watch for social isolation, people who used to be really social who suddenly are not, if those big changes. And it can go the other way too, it's a little more unusual, but if there's somebody who was an introvert that all of a sudden needs to be the center of attention and is really looking for like people to, whether it's agree with them or support them in some way, that's something to be aware of also. They're looking for something. An increase in overall anxiety. Most people won't label it as anxiety. Most people will say, I just feel jittery all the time. Or I feel like there's like this movement I can't get rid of. Difficulty sleeping. Most people will tell us that because they think that's something that's okay, right? You're allowed to have trouble sleeping from time to time. Change in eating habits. Higher intake of alcohol or substances, including caffeine and it's always funny when they talk about these things because mental health people live on caffeine. So I have nothing I can say about that. Other than I know better and I still do it. Communicate frequently and effectively. We're going to create communication plans, schedules for your home. And some prefer to do that in a structured way. We talk about family meetings, right? Every Sunday night we're going to sit down and we're going to talk. And some people will hate that idea. So you just have to sort of know who lives in your house. And I know in a lot of your situations, it's not like everybody's going to sit down and have dinner at night, at 6 o'clock and we're all going to talk about what we did today, because schedules really don't allow for that anymore. But we want to try to find some sort of time to sort of check in and say, how was today? When my kids were little, we used to say, okay, tell me what the best part of today was, and we'd start there because my kids tended to get off we'd be walking home from school and we'd get and then this happened and then this happened and then you wouldn't believe what he said. And I thought, my kids are miserable all the time.
Yeah.
But it took a little while to get to and then so-and-so told me this and I got invited to do this. For some reason, they were just very negatively focused. And my younger one, I finally learned it was whatever happened last. Like, if he tripped coming out the school door, I was going to hear for the next hour how terrible things were. If somebody handed him a cookie right before I saw him, the day was awesome. That was just how it is. And he's 17 and it's still true. So I try to meet him with a cookie.
Lead with a cookie.
So it's just kind of figuring out how people interact with those kinds of things. Discuss how difficult situations will be managed together before they arise. And I always think back to when my kid came home the first time, and actually even when I was in first grade, and I came home to my parents and I said, we're supposed to have a fire escape plan. And I was very serious about the fire escape plan. And I drew the map and I told everybody, if you're in this room, then you're going to go down these stairs and we're going to meet at the mailbox. And I looked at my dad and I said, we need to practice the fire escape plan. And my dad looked at me like this. And I thought, well, how are we going to know what to do? And he said, you just told us what to do. You know what to do. And I was like, but how am I supposed to know that you're going to get to the mailbox if you don't practice getting to the mailbox? Because in my 6-year-old brain, it was really important. And then my 6-year-old came home and said, we need a fire escape plan. And I said, I can tell you, we're going to the mailbox. I can't tell you what room I'm going to be in when the alarm goes off. And he, of course, says, well, then I'll push the alarm and you can figure out how to get out, whatever. And so 2 a.m., off goes our fire alarm because my kid's standing on a chair in the stairs so that we could practice. But we did it because I was not my dad. And I was willing to do that and show that we know where those pieces are. But it is really difficult to say, we can't know what all of those difficult situations are going to be, right? I mean, we're trained on fire responses. We're trained on, if you get lost as a kid, what do? You stay exactly where you are. You tell an adult, your name and your phone number, all of those kinds of things. And hopefully you have a sticker on your back that has your mother's name, or whatever it is that you decide to do. But we can't predict all of the things. What we can predict is that at some point in time, something might happen that's difficult, right? And we might want to have a way to say, this is what we're going to do when something happens. And that might mean we're all sort of going to meet in this space and we're going to have this conversation and we're going to talk about these things. It might be, this is how we're going to support somebody else who's going through this. We're going to set up the meal train. We're going to do their laundry. We're going, so that you feel like you have some sense of control when things feel like they're out of control and you have a plan. So having a plan for major stressors can alleviate confusion and frustration. And my mom right now is going through some health things, right? And she's 84. She is very resistant to needing help still.
Oh, yeah.
And raising my mother is harder than raising my children, for those of you who have been in that situation. And so she called me and she said, I fell. And I said, okay, so what happened when you fell? And it turns out she didn't just fall, she passed out. And she hit her head on the way down. And she's saying, but it's okay. And I'm like, but we have plans. We're gonna go have somebody look at this. You know, all of these things. You're on these medications that are blood thinner. You know, we want to make sure that they're not bleeding things. And she's very resistant to that, to the point that the next time she fell, she did not call me.
Yeah.
And she ended up, a neighbor came over and took her to the emergency room. She called me the next day and she said, well, I did write you a letter. So that if you came in and you found me, you would know what happened. And I'm like, that's really not the way we want to deal with these things. So sometimes you can have a plan and it doesn't work because somebody decides not to participate, right? 84-year-old mothers. But we want to know that we have some idea of what it is that's happening there. We're going to avoid having discussions where emotions are running high. And so if we can have those conversations of how we're going to handle things before that moment happens, then we don't have that, rah, we need to do this now kind of reaction, right? When somebody's dysregulated, which just means they're having a hard time being where they need to be emotionally, or they're distracted, or there may not be enough time to fully address the topic, we want to be aware of that, right? Sometimes in those situations you want to give directions, and you want to say, we're all going to go out and we're going to sit down and we're going to talk to these people and we're going to figure out what it is that's going on. We're going to bring in somebody else who's going to help us because obviously this is too much for us right now. And so it helps to have those people available. Communication skills. Save the conversation for a calm moment, right? We're all, whatever your reaction is, there's kind of this feeling and we don't communicate very well when we have these feelings. Wait for a time when you and your partner are alone without distractions or interruptions. And I know in our house, when I say the words, there's something we need to talk about, that conversation is probably over, right? I know we need to talk about it, and they might know we need to talk about it, but we're probably not going to talk about it. So you want to be careful how you set those up. And I know when my husband says to me, so I was thinking.
That's dangerous.
We're either buying something we don't need, or we're going somewhere we're not prepared to go, or and he will look at me if I ever say the words, can you help me understand? Like might as well be leaving, right? Because we are not going, no, I cannot help you understand. There is nothing I can say that will help you understand. And you want to make sure that you're relaxed, not tired, hungry, or stressed. Good luck finding a time when those things are all true. Use gentle body language and tone of voice. Take an attitude of teamwork and problem solving rather than arguing or blaming. So how are we going to solve this situation? What is it that's going on? What do we think the primary problem is? And how do we find something that's solution focused rather than just going back over and over and over again what it is that's going on? Because it doesn't really get us anywhere, even though we really just want to be right a lot of the time, right? And unfortunately, we all just want to be right. Speak calmly without raising your voice. It's a challenge sometimes. Avoid hurtful body language such as eye rolling, scowling, or mocking. Anybody who's had a teenager knows exactly what those things are. Especially the eye rolls where they're so far back in their head that you feel like they should come back around. I statements. We started learning this in 3rd grade. In a lot of ways, I think they're effective. In other ways, I think they've become so cliche that it becomes difficult when somebody looks at me and says, I feel like you're driving me crazy. I feel like that's like the Saturday Night Live skit, right? That we get to. Like as soon as somebody looks at me and says, well, I feel, when this happens, I know it's coming, right? But it does stop us from doing the, and you did this, right? Which is obviously going to shut somebody down. Describe the problem clearly. Discuss one problem at a time, which can be really difficult because those are those little tiny traumas that compounded on each other, right? Yesterday you told me this, and the day before you said this, and they're really related for me, right? But if we're only going to solve yesterday's problem, then I need to focus on yesterday's problem. Be specific. Broad complaints like the house is a mess, as mine is, may be misunderstood. I don't know how that's misunderstood because my house is a mess. And they all know it, and they all ignore it. And be respectful, make a polite request rather than a demand. And sometimes that feels like I thought I asked really nicely, right? But the tone that they got or the state that they're in, that didn't come across that way at all.
You're dealing with health professionals. They do a lot of, you need to, or we need to, this needs to happen.
Mm-hmm.
They're used to
That's-
giving the
oh,
instructions.
absolutely.
Yeah.
That's how that's how it's.
Yeah. And do you feel the need to say, I am not the patient
I,
here?
I do. So I tend to keep my mouth shut, but I have 2 kids, and when I approach that way, I see the invisible iron gate just
Yes, the
slam
shield
down.
goes down.
The other one will go back at him, but the other 2 just like boom.
Right.
And they
We know
wait till
that's
he's
over.
done.
Yeah. Let
And
him
they
say
think
what he's
all the
gonna
stuff
say.
they're thinking, like, no, I don't need to, just because you said so, or whatever. But it's not constructive.
Right, right.
Yeah.
And I think obviously we're approaching it in that way because we think it would be,
Well,
right?
and-
And sometimes it would be for
That
us. It's just
works.
not for them.
In their work situation, that approach
Absolutely.
is absolutely, it works.
Well, and I think that's
how
what
they get
they-
things done.
That's what they have to say, right?
Right,
Because
right.
the patient is going to be like, well, I didn't really tell me that I needed to lose weight. He sort of went around, like, hey, you have to, they have to be willing to
direct.
say,
Yeah.
you need to take this medication every day,
Mhm.
right? This is the rule, essentially. This is what's going to help you, as opposed to when he's talking to you,
Yeah.
that might not be the same. Yeah. Okay. Time for help. Seeking help from others. Knowing the limits of what's manageable without assistance is important, right? And I think as the support people in people's lives, it's really easy to say, I'll help you with whatever you need. I'm here, right? And then you start hearing all those stories and you're like, I was here. I was willing to do that, and I want to be willing to do that, and I'd like to be able to handle that, but gosh, that's a lot, right? And I can feel for you that that's a lot. And I can also feel for me that it's a lot. And us both coming down from this is not going to help us, right? Because I can't be that support person in life if I'm feeling so weighted down by the things you're telling me. And so there are different things that come in, and there are reasons why all of these have been created, right? Because it's too much for one person to take on. And so we have things like community-based groups. I assume through physicians' networks, they have some things. With kids, we're really careful about the friends part of it, because a lot of them will be like, oh, let's talk to my friends, right? And then the friend shows up in your office at the school, and they're like, and this person just keeps coming to me, and they keep telling me all this stuff, and I don't know what to do about it, and I'm 12. And I can't handle that, and so, like, we want people to be able to talk to their friends, but you also have to recognize that your friends are not trained, right? And they have their own things going on, and they have, like, your T might be pressing down on their T's without you having any way of knowing that, right? And so we have to be willing to hear friends when they say, I want to be supportive of you, but it might be time for you to talk to somebody else. And that's how I'm going to support you, is by encouraging you to do that. Because there are people who this is what we do, and we have experience with this, and training. And we have opportunities to decompress, so I can take that on and not have to hold it, right? And I'm not living with you, right? Because when I'm living with you and we get up the next morning and we're starting all over again, right? In my situation, I have a little bit of distance there. So those are the mental health professionals. Counselors, therapists, psychiatrists, prescribers, all of those kinds of things. Resources. STAR is this stress, trauma, and resilience team, is currently available to provide personal, confidential, one-on-one phone support. And they'll respond to you within 24 hours, and they're an amazing team. And there are also some loss teams that we now do some work with, that whether it's a suicide situation, a traumatic loss, those kinds of things, they come out, they sort of wrap around you as a family and as a community to sort of help you through those things. And they have some support groups and all of those kinds of things. I know Ohio Health has grief support groups. A lot of those major things do. The Wellbeing Checkup and Referral Engagement Service is a simple, free, and anonymous checkup of your mental and emotional health. So we use these for well-checked, primarily for adults. We do kids differently, but somebody's called us and said, somebody's reporting this, and we're just not sure what it means. And so we're going to send somebody out and have them talk to that person and see where we are and what we need to do. Caring for your physical and mental health can help you stay at the top of your game, but often the demands of practicing medicine and life in general can get in the way. That's why the Wellbeing Care Service was created, to give all Ohio healthcare professionals a confidential tool to quickly assess your mental health and emotional health. And
And we have some of them
and
that are
access.
talking about that.
Yeah, good. Okay,
Yeah.
Bless you.
go ahead.
Just trying to undo my work.
988 is the new number. I think it's been about a year. It makes it a lot easier for us because I used to have all sorts of numbers in my phone to give kids based on where they lived and who they talked to and all of those kinds of things. It connects to your local number. So like in Delaware and Morrow County, we have Helpline. 988 connects directly to them, so they know your local resources. They know the things that you need to know. They know who to contact if somebody needs to be assessed, how to send somebody out, all of those kinds of things. So it isn't like somebody sitting in California that gets a call from Columbus, Ohio, and you say, I don't know what to do, and they're like, I don't either. I'm too far away from you, right? So it's going to hook into your automatic line, and it just makes it so much easier to be able to have that number available. Physician support line. I'm assuming you guys know about some of these kinds of things. No appointments, call for any issue, not just a crisis. They report to no one, and I think that's important on all of these things. Backing a front line reports to no one, right? There's not any sort of paperwork that needs to go to anyone. It doesn't go to your employer. It doesn't go, any of those kinds of things. It's completely confidential. And so those kinds of things become really important as you're trying to deal with things that are part of your profession.
And to add to that is the medical board is just, and they're working with the hospital association too, but that it's fine, that it doesn't go anywhere with this, but when you're asking these questions, hey, you have to report, have you had any kind of mental health help in this year, whenever that period of time. And the medical board is changing that. The
Good.
questions are changing. It opens everything up, and this has just happened through the OSMA in the last
That's awesome.
3 weeks or so, that they're all talking and getting that completed. So, but they need to hook in the hospitals because the hospitals are asking the exact same questions at your hospital.
Yeah, because that's a huge barrier for
It is.
Right.
They're not going to.
professionals.
They're not going to
gonna
get
say-
help.
Right.
They're not going
Yeah.
to get help.
And we're
that's-
hoping that they're starting to, they
Yeah.
collectively as this whole group of
Right.
people, right, is starting to understand that getting help isn't a terrible thing, and it doesn't mean that you're not a good medical professional. It means there's a lot going on and you need some help through that, and that's
And
perfectly
this-
reasonable.
The medical profession, physicians are not liars. So then when someone
Right.
says, have you had any
Yeah, they're
need
gonna
for
say
help?"
yes.
You're going to say yes. And
Yeah.
so it really has put them in a corner
Yeah.
where they say, I'm just not gonna go get help. So it's gonna take a lot of time and effort to get that turned around where people begin to feel
Right,
comfortable.
and it'll take a while for them to trust that
Yeah,
that's
trust
true.
it.
Yeah.
Right.
This is us. You can also go through Psychology Today to find providers in your area that it'll list their specialties and all of those kinds of things. And certainly, if you ever need us, we're here, and we do a lot in Dublin and surrounding areas with all of those groups. So,
I was gonna add too, because it's so exciting, over at OU, they have a person there who works with the medical students there. And they're here in Dublin, there's a whole school over here. And so right now, she meets with them if they're feeling, stressed.
why would they be?
And so that's been, and then she's gonna be starting some programs and things like that, but then also wants to work with us. We've had several different meetings talking about how she's nurturing and working and helping medical students too, so.
And hopefully teaching them that it's okay to ask for help when you need it,
Yeah.
right? And so
Yes.
that in turn hopefully goes up as they
Yeah, as they're going.
As they're going through that process.
time. Any questions that anybody has or like to ask today? So we appreciate
Oh, absolutely. Thanks
you
for having us out.
taking the trip over here and being here and
Great. I actually grew up here. I went to Indian Run, and
No way.
when we